Hi, everyone. Happy Sunday. Welcome to This Week with Mallory, our live stream happening this time on the weekend. Thanks for joining us. And we are going to go ahead and get started with some really somber news. This has turned into a national and international news story, but a lot of us knew Sam Wool really, really well. Sam was tragically killed in Detroit, and investigations are still ongoing. I know the Detroit Police Department is working with the Michigan State Police and the FBI. And this is a really heavy loss for a lot of people. Sam was not only the president of the downtown Detroit synagogue, but really, really active in Michigan politics on really just caring for people. Many of us have known Sam from the campaign side of things. She worked for Padma Kupa in her first state house race when I was running for the first time. So it felt like pretty much every day in 2018 on forward, we saw Sam. And Sam was somebody who I don't think ever had a bad day. And if she did, you didn't know about it. She was always positive, always optimistic, and she has really been a driving force in this space. She worked for Stephanie Chang. She went to college with Stephanie, worked in her constituent services team on her campaigns. She worked for Congresswoman Alyssa Slotkin as her deputy district director, as well as for Attorney General Dana Nessel on her campaign. But this is just somebody that, like I said, it's going to be very strange not seeing Sam at events. So I just wanted to say, yeah, it's hard. And our hearts are with Sam's family and all of her friends. And she's going to leave a really big gap and a hole that's going to be hard to fill. So thank you, Sam, for everything. And you didn't have a bad bone in your body. And just, I hope in this moment with how tense everything is, that people let this be about Sam and that we take time to find out what happened. I know that's what she would have wanted. She wouldn't have wanted to be used as a wedge. So thoughts, whatever, with everybody. Really heavy way to start, but we absolutely had to. So we miss you, Sam, already. All right. With that, we will move on into the rest of our live stream. So welcome back to what I wish was a more regular live stream than it has been. That is because of how busy we have been in Lansing. So we are hopefully regular time is going to be every other Tuesday at 2:30 p.m. But as you've seen, today is a different day. So we are going to try to hop in when we are able to and move forward from there. So thank you everybody for joining us. For those who are popping on maybe for the first time, this is a live stream that we hold across Facebook, YouTube, Twitter, and LinkedIn. It is live. You are able to ask questions and comments by typing into the comment section of whatever platform you are on. Please go ahead and put your name and the city that you live in so that we can make sure that we are addressing constituent comments moving forward. So where are we now? We wanted to start with an update on the UAW stand-up strike and share where we're at in this moment. It's not only in the automotive sector. We also know that casino workers are on strike. There are UAW workers on strike with Blue Cross Blue Shield, but wanted to share an update specifically on what is happening in the auto industry. UAW had announced their strike. This was the first time in history where they announced a strike against all three GM, Ford, and Stellantis simultaneously. And right now, over 9,000 workers are walking the picket lines in Michigan. The automakers and the union have remained far apart, but it sounds like negotiations are improving. Sean Fain, the UAW president, had his live stream this week and announced that due to progress in negotiations, they did not expand the strike from where it was right now. But it is going on more than 30 days. We know that this is challenging on all of our auto workers, but really, auto workers made very deep concessions during the recession when the automakers needed a bailout from the federal government to survive. And I think a lot of auto workers right now are feeling like that was the right thing to do at the time. But since then, we have seen not only our three major automakers here in Michigan recover, but post record profits. And as we've seen CEO pay continue to increase, the workers want their fair share. So the latest is that automakers have raised their offer to over 20% raises, but they're still not quite where the UAW and workers are demanding just yet. So I just want to reiterate, we support the workers in this. This is not about pitting the workers against the companies. This is in line with what we're seeing all over the country. Workers are striking across many, many industries because when you consider inflation and what a dollar does these days, it shouldn't be controversial to say that workers should have a living wage, should be able to support themselves and their families and have good jobs moving forward. So we'll keep you posted on that as we hear more. Moving into legislative updates from Lansing, we have been very, very, very busy, which is why we are doing this on a Sunday and not at our normal time during the week. So wanted to share a number of updates from the legislature from the past few weeks, including updates on the Prescription Drug Affordability Board, an update on auto NoFault fixes, legislation that has moved there, an update on the Clean Energy Future Package, domestic violence firearm bills, the Reproductive Health Act, an update on license plates, as well as the Make It in Michigan package of economic development reform bills that I have been leading on. So, starting with the Prescription Drug Affordability Board. What the heck is this? The Senate passed these bills last week. A Prescription Drug Affordability Board would be something that we would create here within the state of Michigan, which would be an independent, nonpartisan board that would review and establish upper payment limits on the most expensive prescription drugs. This board would have the authority to review prescription drug costs and evaluate their impact to Michiganders. And among many of my colleagues and advocates, something that we hear often is a prescription is not very good if the people who need it cannot afford it. So this is the challenge that we are trying to solve with this independent board, which would review and start to put constraints specifically as it relates to Michiganders. Now, is this going to fix everything related to prescription drug affordability? No, of course not. I don't think anybody is under the false pretense that doing this here in the state of Michigan is going to solve everything. But in a moment where Congress cannot even meet right now, they are not functional at doing their job. We know that this is a major overhaul that needs to happen on the federal level, but that doesn't mean we shouldn't try to do everything we possibly can within the states to help ensure that prescription drug costs are affordable for the residents of our state. Like any public board, the public would be able to weigh in and provide comments to the Prescription Drug Affordability Board, and nonpartisan leaders across economics, healthcare, and supply chains and academics who have no personal or financial stake in the pharmaceutical industry would be appointed to this board, and there would be strict rules in place to prevent politicians, representatives from big pharma who are advocating on their own behalf, or healthcare industry or special interest groups from influencing the board's decisions. This is not unheard of. 6 states have already established a PDAB, a Prescription Drug Affordability Board, to successfully set upper payment limits on the most expensive prescription drugs in their states, and additional states are looking at this legislation now. So Michigan would be one of the leaders, but we are following already in the footsteps of a handful of states who have taken the lead. All right, next, auto NoFault. Back in 2019, the Senate pushed through a comprehensive reform to Michigan's auto no fault insurance law. To give you a little bit of background, Michigan before 2019 was the only state in the entire country that guaranteed you lifetime healthcare access if you were catastrophically injured in a car accident. Now, it is also true and worth debate that Michigan also has the most expensive auto insurance rates in the country. So, something that has been really elusive in Lansing is how do we address this affordability issue? And what was pushed through in 2019, I think, had some really devastating consequences. The auto no fault reform of 2019 eliminated the guarantee or the requirement that every driver purchase universal lifetime coverage, and it instead gave drivers the option of taking reduced coverage for the promise of reduced rates. I was one of only 4 senators in the Senate at the time to vote no on this bill package, not because we don't want lower rates, but because the legislation, as I saw it, had no guarantees of rate coverage, certainly nothing that would be very meaningful. But what it did was that it asked you to take lower coverage for the hope that you might get lower rates. And what we've seen since then, we've heard from countless of you that your rates have gone up. They have gone up precipitously. And worse than that, the interpretation of the 2019 law was retroactive. So there are people all across our state who had already been injured in catastrophic car accidents. And because of our previous coverage, were able to live fulfilling lives. It might not have been easy, but if you were permanently catastrophically injured, if you were no longer able to walk, we have some people who are no longer able to talk, you may need 24-hour in-home health care. You may need very complicated brain rehabilitation or spine rehabilitation. This is care that is very expensive, but there was a promise made to people that you were guaranteed this lifetime coverage. And for these people throughout the state, they immediately saw their care sliced. We saw that they could no longer afford their in-home healthcare workers. They could no longer afford the rehabilitation that they needed consistently in order to continue to live a fulfilling life. So we've passed legislation that does not undo the 2019 auto no fault reform, but it is the most immediate need to fix some of the unintended consequences of the 2019 reform. So these bills would apply to injured survivors of accidents that occurred after June 10th, 2019, and those who were injured before. The amendments would require that physicians, hospitals, clinics, and other providers of treatment or rehabilitative occupational training of survivors with personal injury protection insurance be reimbursed at 250% of the amount payable for that treatment under Medicare, which is up from the 190% rating that took effect in July. And what we've heard from a lot of care providers is, especially given how tight the labor market is right now, that 190% was a significant cut from rates they were getting before 2019. And we were seeing particularly in-home care providers, just close or not be able to get staffing. The legislation also would scrap the current fee reimbursement schedule of 52.5% of non-Medicare coded services and instead put in place a specific dollar amount depending on the type of care and service provided. And it would raise the reimbursement cap that the reform placed on personal and family provided attendant care. So this is if you're immediate family member, this happens frequently with many people who suffer catastrophic accidents. There are a lot of immediate family members who, because of how life-changing this event is, people are quitting their jobs to care for their loved one full time. People can't afford that unless they're getting paid. So if an immediate family member is doing the work of being a full-time care provider, this increases the 56 hours a week, which was what the cut was under 2019, to 112 billable hours per week. And the bills would also institute specific accreditation requirements for agency providers. So this is really addressing those who are the most vulnerable in our state who need this care And I was proud to vote in support of moving this through. And this package now moves on to the state house. So just as a kind of clear barometer of where we are, this is not law just yet, but it is incredible progress of getting through one chamber, hopefully on to the other chamber, and hopefully going towards the governor's desk. Next up, Michigan Senate Democrats' Clean Energy Plan. What is this and what can you expect? This plan proposes a number of things. These bills are still in various places within the Senate, and we've heard from many, many, many of you since we have taken office in the start of this year who are pushing for us to do the right thing when it comes to climate change, knowing that this is an existential threat to all of our residents to move forward into a more aspirational clean energy environment. And this is not something where we have to choose right now, right? So right now, Michigan has more clean energy jobs than any other state in the Midwest. We are leading here. So this is an opportunity for us to lean in, frankly, align with some of our other Midwest states and ensure that we are tackling climate change head on and positioning ourselves to succeed in the clean energy economy. This plan, as proposed, includes phasing out coal-fired electric generating plants by 2030. This now will be amended to 2040 due to negotiations internally. Energy waste reduction, achieving at least 2% annual electric energy efficiency savings. This would expand the ability of the Public Service Commission to enable them to have a broader scope when it comes to climate, health, equity, and affordability. So this would empower the MPSC to do more to ensure that you, as a DTE or consumer's customer, have access to reliable energy and affordable energy. We know that that has been a huge source of frustration and something that rightfully gives people pause as we are talking about pivoting to a clean energy future is how are we going to ensure that my power stays on? So this would empower the MPSC to do more in that area as well. This would codify the Michigan Department of Agriculture and Rural Development's PA 116 program, which allows farmers to rent land for solar operations while maintaining preservation of farmland. So this adds solar into the preservation of farmland statutes. Adapts a clean fuel standard to reduce the carbon intensity of transportation fuels by 25%. And part of the lawmaking process, as with anything, is compromise. So these bills have not yet passed, but we are continuing to take your feedback. We are continuing to push for these to get done by the end of the year. We know that it is a priority for so many of you. It is a priority for me as well. Moving forward, October is Domestic Violence Awareness Month, and it is really apt that this is the month that we passed some really crucial bills in the Senate. So many of you know that earlier this year, we passed the first comprehensive gun violence prevention package of bills in my lifetime in state history, including universal background checks, safe storage, and enacting red flag laws here in the state of Michigan. But that wasn't enough. Right now in the state of Michigan, unless an individual is convicted of a felony for domestic violence, there really is nothing in state law that keeps firearms out of the hands of domestic abusers. Oftentimes, we know that it is incredibly challenging for victims to file cases related to domestic violence and get them charged. And we know that a lot of individuals who have a history of domestic violence, of violence against pets in these situations, that can escalate really quickly. And that if there is a pattern of behavior, adding a firearm to that situation can be deadly. So this is a package of bills that would prohibit a person convicted of a domestic violence misdemeanor from possessing or using a firearm or ammunition until they complete their sentence and parole or probation and pay all of their fines. And it would also include an 8-year waiting period to regain access to firearms. And this aligns the state of Michigan with federal law. This also includes having a separate misdemeanor penalties and fines for violations such as breaking and entering and vulnerable adult abuse. This is something we do not hear often enough when it comes to domestic violence. There is an abuse of our seniors. This is really devastating. It is not covered nearly often enough, and is included in this package as well, not just in romantic relationships, but ensuring that we are covering domestic abuse in all of its forms to keep people safe. Next up, I want to share an update on the Reproductive Health Act. What the heck is it, and what did we do here in the Senate? So, in 2022, Michigan, thanks to hundreds of thousands of volunteers and grassroots efforts and signatures and activism, we passed Prop 3 on the ballot, which codifies abortion access and reproductive health care into our state constitution. So it is now a guaranteed constitutional right for anyone to seek reproductive care or abortion access. And a lot of people probably saw that and said, That's incredible. We're done." The reality is, we're not done. There are still many, many laws on the books that make accessing this care incredibly challenging or near impossible, depending on where you live. These are what are commonly referred to as trap laws. These are restrictive access elements that are put on clinics that have no basis in medical science, things like a 24-hour waiting period, things like requiring clinics to have admitting privileges to hospitals when we know that most abortions are actually performed in the first trimester and many can be done via medication. So you're going above and beyond to require many clinics to operate as surgical centers when they may never perform a surgery at all. And if you are in a more rural area, this has meant that oftentimes you do not have access to a clinic at all. So the Reproductive Health Act would really align access and availability with the intent of the voters from Prop 3. Voters across the state of Michigan said very loudly, "We trust women to make decisions with their doctors, and politicians have no place in this." However you personally feel about abortion, the by and large loud agreement was, this is not a place for politics. This is a place for decisions to be made between individuals, families, and their healthcare providers. So these bills do the following. They repeal the mandatory 24-hour waiting period. This is something that there's a lot of misinformation about. And a few years ago, I shared a story on the Senate floor from constituents who had shared just a really, really heartbreaking story of a pregnancy that they had wanted that was going really well until after the 20-week appointment, when they learned the devastating news that the collagen of the fetus was simply not developing. And it was very, very unlikely that the fetus would survive to term and to birth. And the wife told me just really horrifying stories about how, as they were pursuing their pregnancy termination, which was already one of the hardest decisions that they ever had to make, that she was forced to look at all of this documentation that showed photos of, what her fetus should have looked like at that point. But what she told me was so hard about that was she knew hers didn't. So this 24-hour waiting period and all of the materials she was supposed to review as part of this law just made her feel worse and reminded her of the pregnancy she could have had, that she wanted to have, that she didn't have. So this is repealing that 24-hour mandatory waiting period, getting rid of the informed consent form. This is the form that includes a lot of that documentation that isn't medically based. It was really created by politicians, and that is not the type of information that you should be receiving when you are working with your doctor on the right form of care for you. And we also know that a delay in care can be medically risky when patients have life-threatening complications. This would amend the Code of Criminal Procedure to delete specified sentencing guidelines related to abortion services, and it would allow pregnancy and parenting student services offices at colleges or universities to provide information to their student body about reproductive health care and abortion services in all of its forms. So previously, colleges and universities were not allowed to provide their students any information about abortion clinics or abortion care at all. They could only refer them to adoption services. So this just ensures that all of the information is available to people, that is medically accurate, so that people are empowered to make the best decisions for them. So again, this is a package of bills that really takes what we did last year in Prop 3 and ensures that our laws reflect the will of the voters and that people have the ability to access this care should they need it. All right. We're moving into something a little lighter. License plates. Back in the first year of my term, I introduced legislation to bring back two of Michigan's iconic license plates from years past. The black license plate with white text that was available from 1979 to 1983, and the blue license plate with white text that was available from 1983 to 2007. These plates would be available for a one-time fee, totally optional, that would be money to fix our roads without raising taxes. There are other states that have done this really successfully. So if you ever travel up to California, you might see cars with plates driving around. They're very cool, black license plates with yellow text. California did this back in 2015. They introduced these 60s vintage inspired plates and have generated hundreds of millions of dollars in new revenue for their state's transportation fund. So these would be completely optional. If you don't want to pay the additional $50, you don't have to. But for people who are complete car enthusiasts like me, if you want to accessorize your car and you're willing to drop $50 to do it, you can. So this legislation passed the Senate. It is on its way to the House. We also added, thanks to a lot of feedback from many of you and an amendment from Senator Erica Geis, for 1 year only in 2026, we would also bring back the bicentennial red, white, and blue license plate that was available in 1976 for the semi-quincentennial in 2026. It is America's 250th birthday, and you can celebrate with a limited edition license plate. So this legislation is on to the House. We hope it gets a hearing and passage and makes its way to the governor's desk. Again, really smart. Free money, fix the roads. Everybody wins with some nostalgia. Look at these fancy graphics we got going on in our presentation today. Okay. Economic development. We will talk a lot more about this because this can be very wonky as we go through it, but many of you may have heard about our state's largest economic development tool called SOAR. The SOAR fund is what has been used to land projects like the Ford battery plant, the GM Ultium battery plant, and it is an incredible amount of money that goes into securing these projects. But what we're seeing is that there is tension between the legislature and the Michigan Economic Development Corporation. There was a question of how much money should we be putting towards these projects, and does it benefit everybody, especially if some of these jobs may be starting at $15 or $20 an hour. Are these really good jobs? Are they going to lead to good careers for people? So we have introduced a package of bills to reform the SOAR fund to hopefully narrow in the focus of what projects are eligible to get into the economic development pipeline, ensuring that we are centering prosperity for all of our residents, not just landing any project. SOAR came out of the kind of reaction to what happened back in 2021 when Ford announced that they were creating a large investment in manufacturing in Tennessee and Kentucky, and people in Michigan felt like they had been passed up for this opportunity. But we feel like there's opportunity for reform. If y'all remember the Amazon HQ2 exercise that we all went through back in 2017, the state of Michigan put up $4 billion in tax cuts and incentives to try to lure Amazon to locate their second headquarters in the Detroit area. And we were told you were not even in the top 20 because you don't have the talent and you don't have public transit. Now, the state of Virginia won this project with a much lower incentive package. It was only $550 million, but they invested more than $1 billion in education from K-12 all the way up through a new campus of Virginia Tech that would guarantee more than 17,000 graduates with computer science degrees moving forward. So we have required in our SOAR reform bills that a minimum of 20% of any total offer package has to go into the community that the project will be based in. This can be infrastructure improvements, it can be investments in community college, it can be a new child care center, anything that will support the needs of the company, but more importantly, the needs of the community. So we've been having a few weeks of hearings on these bills. It's going well. Hopefully, they will move on to the House and we can keep moving forward to really strike a balance to say we understand that sometimes incentives are necessary in economic development, but let's do them smarter to ensure anytime we are spending your taxpayer dollars, we are guaranteeing prosperity outcomes for our residents, not just landing projects. Last but not least, before we open it up for questions or comments, we have good news to share from the district, starting with this month, a Berkeley Department of Public Works employee, Brian Lapine, and two coworkers, John Beach and Brad Doherty, were driving down a residential street and saw heavy smoke coming from a house. They called 911 and notified the homeowners, who were able to make it out safely along with their dogs. The occupants actually had no idea what was happening because the fire was spreading within the walls and there was no smoke inside the home. Berkeley Public Safety firefighters arrived on the scene, as well as those from Huntington Woods, Oak Park, and Beverly Hills fire departments to assist. So huge thanks and a shout out to these public works employees for recognizing that something was wrong and taking action to save lives and to save this family from a much worse situation. Next up, huge congratulations to Royal Oak High School senior Natalie Forsyth for being a National Merit Scholarship semifinalist. Scholars represent less than 1% of our country's graduating seniors who qualify. Semifinalists must fulfill several additional requirements to advance to the finalist level of the competition before being considered for a National Merit Scholarship. So good luck and congratulations on making it this far and being in the top percentage of students around the country. We are so incredibly proud of the young people who come out of our communities, and I know she's going to go on to do just incredible things. Last but certainly not least, Gigi Alexander is a 15-year-old resident of Huntington Woods who has made a big impact with a project for her Scouts program. Gigi fundraised for and distributed 100 children's shoes that expand 5 sizes larger to a village in Honduras. This project is called The Shoe That Grows, and she started it with the intention of helping kids impacted by poverty. The shoes last 4 years, and as somebody who has a 2-year-old going into a 3-year-old, I know how impactful this is going to be for these families and for these kids' lives because, man, these little seeds keep growing and they grow out of their shoes so quickly. These shoes will last for years and they will protect children from diseases and parasites. The Shoes That Grows is part of her efforts to reach the rank of Eagle Scout. Well done, Gigi. Congratulations and thank you for being a model that so many of us can learn from. And with that, I'm going to stop sharing my screen and bring on my Chief of Staff, Emily, to facilitate any questions, comments that we have this week.
Hi, everybody. So we have a couple, no questions yet. So if you have them, please feel free to throw them in there and I'll make sure to read them off. Jane O'Shea, one of our constituents that we know well from Birmingham, did want to voice her thanks for your support and your vote for the domestic violence firearms package. So she's going to be attending the hearing this week and she'll put in a card of support. So just some thanks from Jane.
Thank you, Jane.
And a couple of different comments, just offering their condolences and sharing their shared grief over the loss of Sam. So thank you all for those comments. Really hard thing for everybody. I can't say it better than the senator did. And that's about what we have right now. We have a comment from YouTube from William J, who's also very excited about license plates on a happy note. So that will be really cool. But yeah, if anyone has questions, feel free to add them on before we jump off.
Amazing. Well, it's a Sunday, so I won't keep
Yeah.
everybody. But Emily, thank you. And thank you. I'm going to let you go and just say thanks to everybody who tuned in. We are working diligently to get these back into the regular rotation. But if you ever miss an episode and you want to know what's going on, they're all available on our YouTube channel, our Facebook page. Come check them out, share them with your friends if you find this helpful. And if there are any topics that you want to know about that would empower you to know more about how we work on your behalf or how your state government works, let us know. Otherwise, thank you as always for tuning in. Hug your loved ones, and we will see you next time.